So planetary health, as Carlos said, is about the impacts of humankind on the planet and how that is affecting us in return. It's action based on science. It is science put into practice. And I'd like to stress the action-based aspect because of the urgency. It's not only science. Science is very important, but we need science put into practice. And of course, it is multidisciplinary and it's global. It all started with this report from 2015. It has grown a lot because of the creation of the Planetary Health Alliance, and so it has grown worldwide. And it brings us a few messages, and that's what I want to highlight to you. The first one is the paradox of our civilization. The huge gains that we have made so far in health and in life in general are under threat. Imagine, for instance, we're here talking over the internet. We have people from all around the world. So this is certainly an achievement. Carlos has also shown very many graphs showing the impacts and the gains that we had in health. So yes, we had many gains, but the fact is that we had that in a way that we have affected all the natural systems. And here we have some example of that. We have pollution on water, air and soil. We have deforestation and other forms of land use change. We have overexploitation of natural resources. And all of that caused climate change, which is only one of the main aspects. Climate change is the most spoken about one. So with that, have had...
Antonio, excuse me. Me comentan si puedes poner en modo presentación porque se ven...
Sí, claro. Eso es lo que preguntaba porque no sabía si... ¿Así?
Ok, perfecto. Ok.
Gracias. We never know what's being presented there, but with what's in our screen and what's there. So thank you. So we came up having climate change, which you can see all around the world. More extreme events with rain, floods, snow, mudslides, but also drought, fires, heat waves, and loss of biodiversity, and that affects our health. So we can see here in many ways in which our health is affected. So it's exposing us to pandemics and other zoonoses, more vector-borne diseases, respiratory diseases caused by pollution, hunger and food insecurity, simultaneously with obesity, which is crazy, mental health problems, migration due to hunger, lack of water due to war, etc. So we can see from all of that our planet is sick. No doubt about that, I think. But we must see as well that we are sick as well. Humanity is sick. So we are in the crossroads. If things continue the way they are, in the same path, in the same direction, we may not have a good future, a safe future, we and our children and our beloved ones, especially because the most pressing problem, which is climate change, will worsen all those problems. The most recent data from IPCC report show a dramatic situation. Not only an increase in the measured temperature, so this is measured temperature, this is real, already happening, but also an increase in the projected temperature change in any scenario. On the left, you have 1.5 global warming scenario, which is not good, but consider the central one and the right one, which is just terrible scenarios, are terrible scenarios. But not only that, it's not only about heating, it's also about increasing the number and the level of the natural disasters. Disasters in terms of hydrological disasters, climatological disasters, meteorological disasters. So this is all happening. And the most recent report from IPCC, just issued a few days ago, shows that an elevation of 1.5 degrees Celsius in the global average temperature is expected to occur in the next decade, not only far away, but in the next decade, if things continue as they are, because currently the global greenhouse gases emission are not decreasing, they are still increasing. So this is crazy. I bring here one of the main messages that planetary health brings to us, which is everything is connected, all human activities and the planet. And this is crazy to bring because this is an ancient wisdom, which we know, we should know that, we are being remembered of that. All the indigenous groups, indigenous peoples know that, they live that way, knowing that everything is connected. It's us, our Western civilization, that don't live that way. Whatever happens to the planet affects us and affects all forms of life. If the planet gets sick, we get sick too, and that's what's happening. Planetary health also brings another message. It is that in order to safeguard the future, it will demand a great transition with changes in all areas. It may sound challenging, and it is, but also we can remember that COVID has shown us how possible it is to change our ways of living. We had to do that, at least for the peak 2 years of COVID. We had to change dramatically everything that we did. So it is possible. Maybe it is possible without having to leave another disaster, another COVID. So what changes? What kind of changes? Well, changes in everything, basically. So changes in how and what we produce and consume in terms of goods, in terms of food, in terms of energy, but also how we build and how we live in our cities, which are really dysfunctional many times, most of the cities maybe. How we see our relation to nature, with nature, and this is something that is very clear in this event. We see alternatives for that. If are we going to continue to act as if we were detached from nature, as if we were not nature, as if we see nature as something that is there to serve us at any cost? But maybe most important than everything else, how we see our relations with each other, other peoples, other nations. We don't see our neighbors as equals, as partners, other peoples, other countries. We don't remember that we have a lot in common, more than we have differences. Our diversity, in fact, is a strength, should be a strength, should be seen as a strength. Maybe because we don't think about what is our place in the world, and we forget about basic human values, which are essential for our existence as human beings, as humanity. And maybe the ground for a real change has to be those human values. So it must become clear, and that's another point that planetary health brings to us, that all are part of the problem. We all are part of the problem, and we must be all part of the solution. I'd like to here quote René Descartes, the French philosopher, who used to say, cogito ergo sum, you will remember, I think, therefore I am. And I would extend that to I am, therefore I impact the planet. We are all part of the issue. We all impact, maybe more, maybe less, depending on how we live, where we live, and Carlos mentioned that as well. But we all cause an impact. Therefore, we all must assume our role to mitigate that impact, those impacts, in fact. We all must be part of the solution. And we have to do it now because it's urgent. So what is our role? What is your role, may I ask you? Are you part of the problem only? Are you part of the solution? Maybe sometimes part of the problem, sometimes part of the solution. Are you engaged to be part of the solution? Do you care about the future, your kids' future, other children, all children, your family, your friends? If you do, if we do, then we'd better help make the change and make it now. So I ask you again, what are your roles? In fact, roles, not role, because we have many roles. As a professional, as a family member, as a friend, as a citizen that votes, that lives in a city, that buys things, consumes goods, water, energy, generates residues and waste. As someone that communicates with others, that shows by your own example, which is very, very important. In each of these roles, these personas, we have something to do. It looks challenging, doesn't it? It is difficult. Yes, it is. But there is hope. There is hope if we act, and if we act now, and if we act together. And one important point is that we have the knowledge to start acting now. What it requires is a change in behavior on the part of individuals and organizations. That is why we cannot see the problem simply from a technical, let's say, or scientific point of view. See COVID and the vaccines, for example, like a very good example. Developing the vaccines was not easy, but it was achieved in a short time, very short time, shorter than ever, shorter than expected. But we had problems with people and governments, including Brazil's government, that argued against vaccination, or a few rich and powerful governments that purchased all vaccines available, arguably to protect their countries, leaving other countries with no vaccines. And worse than that, letting the vaccines expire. Is that a technical problem? No, it is not. Is a political? Yes. Is a behavioral problem. Still today, only a fraction of the population, of the globe's population, has been properly and fully vaccinated. Maybe some of them haven't even got one shot of vaccines. I'm happy to have received 5 shots. So another important message is that planetary health must be for all. A long-lasting solutions must be inclusive solutions. There's no way for someone, some country, to escape climate change. It is global. See more floods in Europe, in US, hurricanes in US, cold waves and heat waves in Europe. I see fires there in Portugal, Spain, other places. I have relatives there. Although, of course, as Carlos mentioned pretty well as well, poorer countries and peoples will be more affected. They have been more affected. They will be more affected. Exactly those that have contributed less to create the problem. That is why we use the expression climate justice. What we see now is climate injustice. The same happened to COVID-19. It is global. It affects all, although disproportionately. So how to advance? What can I do? What can you do? There's a lot that we can do, from small to big things, remembering that we have many roles in our lives. Spread the word about these messages. Include them in your classes, your reports, your papers, conversations at home, everywhere. All these things that I mentioned, the interconnectedness of everything, the fact that it has to reach, we have to reach, involve everybody, it must be to all. I believe a lot in civil society taking the lead. We can't wait for governments, for private sector organizations to act. We must act and press them. Join the alliance. There's a Planetary Health Alliance. Join your national group. Start a group. In Brazil, we have created a very active and strong group, the Planetary Health Brazil. There are groups in other countries. Planetary Health Alliance has regional hubs in Europe, Africa, Asia, Latin America, Caribbean, Oceania, to mention some that I remember by heart. Join them. Again, how to proceed? Well, we have a guide. We have the São Paulo Declaration on Planetary Health. It is called São Paulo Declaration because it was written as part of the 2021 Planetary Health Annual Meeting, which was held here in São Paulo, though online. What it is an urgent call for all for a rapid and deep change, deep shift in how we live. And it brings concrete actions for all, including message to 19 categories. It was developed by the planetary health community with hundreds of people from many countries using a United Nations Development Program online platform for consultation and for writing the document. And it's available in many languages, 7 languages. English, Portuguese, Spanish, French, Arabic, Russian, and Chinese. It has already been signed by more than 350 institutions from more than 50 countries and another many hundreds of people, of individuals. So you might sign it too, and your institution might sign it too. That's important. We need that support. We need to be part of a single thing. As I said, it brings many, many messages. One message is for all of us, setting an intention. Consider ourselves as partner in planetary healing. But there are messages to other groups, and I'll just pass briefly to name them. The agricultural sector and food systems, which is considered central part because of the impact that it has on the environment, because of agriculture, and also because of the impact that our diets have in agriculture and in our health. But also a message for artists in general, for businesses, for cities and for urban planners, for economists, for financial institutions, for funders, for governments, for health practitioners, for the health sector. The health sector, by the way, would be the equivalent to the fifth most, the highest emission gas, the fifth most, the fifth biggest country in terms of greenhouse gas emission. Sorry for the confusion. For international organizations, for jurists and lawmakers, for media, for researchers, for schools, for spiritual leaders of all faiths, for technology professionals, for universities and higher education, and for youth. So I bet you have found yourself in one or in many of those groups. So there's no excuse. We have many things that we can do. So in conclusion, there's a lot to do. There's a lot being done that is good, and a lot of inspiring good examples. And here, just look around and see the amazing works that are being presented in this meeting. I was really astonished to watch and to hear about all these things. They all encompass the concepts of planetary health, although maybe they do not explicitly know that, do not mention planetary health. But I hope that we will adopt it from now on. That will give us more strength. And there are many other initiatives and projects to work with. So connect with them, join the force. Let's change the game. We can change the game, but we need to act now and act together. So thank you.